Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. I'd like to discuss some ongoing symptoms.
Of course, tell me what's been going on.
For the past 6 months, I've been experiencing severe joint pain and stiffness, especially in the morning. It's getting harder to even do basic tasks.
I'm sorry to hear that. How old are you currently?
I'm 52 years old.
Have you noticed any other symptoms? Swelling, redness, or warmth in the joints?
Yes, my fingers and wrists are often swollen when I wake up, and they sometimes look reddish.
Are there any other medical issues or surgeries you've had recently?
I had a knee arthroscopy about 2 years ago due to a torn meniscus. But other than that, no recent medical concerns.
Are you on any medication currently?
Just over-the-counter ibuprofen for the pain and a multivitamin.
I see. Given your age, symptoms, and the duration, it sounds like you might have rheumatoid arthritis. We'd need to do some tests to be sure, including blood tests and perhaps some imaging studies.
I've read about that. It's an autoimmune disorder, right?
Yes, that's right. The body's immune system mistakenly attacks the joints, causing inflammation and pain. If left untreated, it can lead to joint damage and deformities.
Is it treatable?
Yes, while there's no cure, there are medications and therapies that can help manage symptoms and reduce joint damage. Early diagnosis and intervention are crucial. We'll start with some tests and go from there.
Thank you, doctor. I just want to get some relief and understand what's going on.
I understand. We'll work on this together.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor. Good afternoon. Please have a seat. How can I assist you today?
For the past 6 months, I've been experiencing severe bouts of breathlessness, especially when I climb stairs or walk a little fast. Recently, I've also noticed swelling in my ankles and feel fatigued all the time.
Your age?
38 years old, doctor.
Do you have any chest pain or palpitations?
Occasionally, I feel a slight discomfort in my chest, but it's not very painful.
Do you have a history of high blood pressure or diabetes?
Yes, I've been diagnosed with high blood pressure a year ago, but I've been irregular with my medication.
Any history of asthma or allergies?
No, doctor.
Do you smoke or drink?
I quit smoking 3 years ago, but I drink socially.
Is there any family history of heart diseases or other illnesses?
My grandfather had heart disease, and he underwent bypass surgery in his 60s.
Based on your physical examination, your BP is 140/90, and there are signs of fluid retention in your legs. Your ECG also shows some irregularities. The symptoms you've mentioned could be indicative of a heart condition, possibly heart failure, or some other cardiac issue.
Is it very serious, doctor?
It's crucial that we address this promptly. We need to get a detailed cardiac evaluation, including an echocardiogram and possibly a cardiac stress test. Based on those results, we can determine the best treatment approach.
I understand, doctor. I should have paid more attention to my symptoms earlier.
It's never too late to take action. We'll get you the necessary tests and determine the best course of action. It's essential to be consistent with your medications and make some lifestyle changes.
Thank you, doctor. I'll follow your advice.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Doctor, my primary care physician mentioned that I should get an echocardiogram. What exactly is it, and why do I need one?
An echocardiogram, often referred to as an echo, is an ultrasound of the heart. It uses sound waves to create detailed pictures of your heart's structure and its function. With this test, we can see the heart beating and pumping blood, allowing us to assess the size, shape, and any potential abnormalities. It's often recommended when there's a need to evaluate heart murmurs, check the heart valves, or assess the aftermath of heart attacks. It's a non-invasive and painless procedure that provides invaluable information about your heart health.
Now look at question 26.
Doctor, I've been experiencing fatigue and unexpected weight changes. My friend suggested a thyroid test. Can you enlighten me about it?
Certainly. The thyroid is a butterfly-shaped gland in your neck that produces hormones essential for regulating metabolism, energy, and mood. Thyroid function tests, primarily TSH, thyroid stimulating hormone, free T4 and free T3, help evaluate how well your thyroid is working. If you have symptoms like fatigue, weight changes, feeling too cold or hot, or mood disturbances, they might be related to an overactive or underactive thyroid. The tests will allow us to determine if your symptoms are thyroid-related and guide us in deciding the best treatment strategy if needed. It's a simple blood test that can give us a lot of insight into your overall health.
Now look at question 27.
Have you heard about the new superfood, the Morris fruit, that's being hailed as a nutrition powerhouse?
Absolutely. The Morris fruit is rich in antioxidants, which play a crucial role in neutralizing harmful free radicals in the body. This fruit has an exceptional vitamin C content, which can boost immunity and also promote healthy skin. When people include it in their diet, they often report increased energy and better digestive health. What's fascinating is that some studies have even linked its consumption to a reduced risk of chronic diseases. It's still being extensively researched in Europe, but the preliminary results are promising.
Now look at question 28.
Have you tried the new aquatic rehabilitation technique for post-surgical knee patients?
Yes, and it's making quite a difference. The buoyancy of the water reduces stress on joints, allowing patients to perform exercises without the full weight of their bodies bearing down on the knee. It can significantly improve flexibility, strength, and overall joint mobility. Many patients express that they feel less pain when exercising in water compared to traditional methods. There's an ongoing study in Australia examining its long-term effects, but so far, the feedback has been overwhelmingly positive.
Now look at question 29.
Doctor, my regular dentist said I might need a root canal. I'm quite nervous. Can you explain what this procedure involves?
Certainly. A root canal, medically known as endodontic therapy, is a procedure we use to treat issues within the pulp, the innermost part of a tooth. When the pulp becomes infected or damaged, it can cause a lot of pain. A root canal involves removing that infected or damaged pulp, cleaning and disinfecting the inner chambers, and then filling and sealing the space. This way, we can save the tooth rather than having to extract it. The procedure is performed under local anesthesia, so you won't feel any pain during the process. Once completed, the tooth may be restored with a crown or filling for protection.
Now look at question 30.
Doctor, I've read about microdermabrasion for skin rejuvenation. How does it work, and is it suitable for me?
Microdermabrasion is a minimally invasive procedure that revitalizes the skin. It works by using tiny exfoliating crystals to remove the outermost layer of dead skin cells. By doing this, we stimulate the skin to produce new cells, boost collagen production, and improve skin texture. The result is a fresher, brighter complexion. It's particularly beneficial for addressing issues like sun damage, light scarring, discoloration, and age spots. Depending on your specific skin concerns, it can be a suitable treatment. However, before proceeding, we'll evaluate your skin type, any underlying conditions, and discuss your expectations to ensure it's the right choice for you.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we are speaking with Dr. Emily Chen, an infectious disease specialist, about antibiotic resistance, a growing healthcare concern. Dr. Chen, could you tell us what antibiotic resistance is and why it's a pressing issue?
Antibiotic resistance is essentially when bacteria evolve to become resistant to the antibiotics designed to kill them. This makes it difficult to treat various bacterial infections, and we're seeing this phenomenon increase rapidly. It's especially concerning because antibiotic resistance threatens the efficacy of surgeries, chemotherapy, and many other medical treatments. It's a global issue affecting everyone, but unfortunately, it hasn't garnered the attention it truly needs.
What's the situation like in the US?
In the United States, we're seeing a significant number of antibiotic-resistant infections. The CDC estimates that every year, about 2.8 million people get an antibiotic-resistant infection, and more than 35,000 die as a result. It's a growing problem, and healthcare systems need to adopt strict antibiotic stewardship programs to curb this issue.
Can you describe an individual case that you've handled?
Certainly. A patient, let's call him Mike, came in with a seemingly straightforward skin infection. He was initially given a common antibiotic, but the infection didn't improve. Further tests showed that the bacteria were resistant to multiple antibiotics. We had to use a last resort antibiotic, which has severe side effects. Thankfully, Mike recovered, but it was a close call and highlighted the grave risks we're facing.
What complications arise in treating antibiotic-resistant infections?
The complications are many. Patients may need to be isolated to prevent the spread of resistant bacteria, and treatment options become limited. There's also an economic cost. Treating resistant infections is often more expensive and requires prolonged hospital stays. Another issue is the psychological toll on patients, who often become anxious and stressed, which isn't good for recovery.
Do you see patients who have chronic issues due to antibiotic resistance?
Absolutely. I've had patients with recurrent urinary tract infections that are increasingly difficult to treat because the bacteria are resistant to multiple drugs. Over time, these chronic infections can affect the kidneys and overall well-being. It's a very challenging situation for both the healthcare providers and the patients.
What can be done to combat antibiotic resistance generally?
There's a lot that can be done. Public education is key. People need to know not to misuse antibiotics. We need better diagnostics to quickly identify the right antibiotic for an infection. Also, healthcare providers need to adopt strong antibiotic stewardship programs. On the research side, we need new antibiotics, but that's a long process and not very lucrative for pharmaceutical companies. Government intervention and public-private partnerships could stimulate more research.
Well, Dr. Emily Chen, thank you very much for sharing your insights on this critical issue.
You're welcome, and thank you for giving me a platform to discuss this urgent healthcare concern.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Just as our cells can sometimes grow uncontrollably, leading to cancer, our heart's rhythm can sometimes go awry, resulting in what's known as a cardiac arrhythmia. But before diving into the complexities of arrhythmias, let's take a journey into the heart's anatomy and its electrical system. Our heart, about the size of a clenched fist, sits slightly to the left in our chest. Divided into 4 chambers, 2 atria on the top and 2 ventricles at the bottom, it acts as a pump, ensuring blood circulates throughout our bodies. These chambers don't contract haphazardly. Instead, they follow an intricate electrical system that dictates each beat. This electrical sequence begins in the sinoatrial SA node, often dubbed the heart's natural pacemaker. Located in the right atrium, the SA node sends out electrical impulses. As these impulses travel, the atria contract and push blood into the ventricles. Subsequently, the impulses reach the atrioventricular AV node, where they slow down slightly, allowing the ventricles to fill up. The electrical impulses then travel to the ventricles, making them contract and send blood to our lungs and the rest of our body. But what happens when this system doesn't work as it should? We encounter cardiac arrhythmias. Cardiac arrhythmias and their spectrum. Arrhythmias refer to any irregularity or abnormality in the heart's rhythm. They can manifest as beats that are too fast, too slow, or erratic. Bradycardia. This is when the heart rate is too slow, usually below 60 beats per minute for adults. A natural pacemaker or the SA node might be faulty, or the electrical pathways could be damaged. Tachycardia. The opposite of bradycardia, tachycardia is when the heart beats too quickly. Depending on where it originates, it can be classified as atrial, ventricular, or supraventricular. Atrial fibrillation, AFib. This common arrhythmia involves a rapid and irregular heartbeat. The atria quiver instead of contracting, leading to inefficient blood pumping. AFib increases the risk of stroke and heart disease. Ventricular fibrillation, VFib, a more severe and life-threatening condition. VFib sees the ventricles quivering instead of pumping. This is a medical emergency as it can lead to sudden cardiac arrest. Long QT syndrome, a hereditary disorder. This condition can lead to fast, chaotic heartbeats, potentially resulting in fainting or even sudden death. While some arrhythmias can be harmless or even go unnoticed, others can be life-threatening. Their causes can range from high blood pressure, diabetes, smoking, heavy alcohol use, excessive caffeine consumption, and certain medications. Treatment and management. Addressing underlying issues often resolves many arrhythmias. When they persist, treatments might include medications, medical procedures, or implantable devices. Pacemakers and implantable cardioverter defibrillators, ICDs, are common devices used to manage severe arrhythmias. In conclusion, our heart's electrical system is an intricate network, ensuring our blood circulates efficiently. Understanding its function and potential malfunctions can pave the way for optimal cardiac health. Just as one would attend to the subtle notes in a musical symphony, attending to the rhythm of our heart is paramount.